There we go. Good afternoon, everyone. I'm MaryAnne Sterling. I am with Connected Health Resources, a technology startup, but more importantly, I wear several other hats, one of which is patient. I have been a patient since a fractured spine at the age of 10, but I have been almost as long as that, a family caregiver. My husband and I actually have 3 out of 4 parents who have dementia or Alzheimer's disease. So I've been on the front lines of this battle for over 20 years. Sad to say, I lost my mom in May, but the lessons that I have learned from this experience are actually priceless. And from my perspective, and I'll just wear the patient and family caregiver hats at the moment, the most important things that our sector has to do is connect, teach others, and advocate. So patients and family caregivers learn so much over the course of their journeys. We need to harness this and give these folks a renewed sense of purpose. And we've heard a little bit about that here today, which is wonderful. There are many examples of sort of peer-to-peer programs that we can learn from today and emulate more broadly. One of my favorites, Immerman's Angels. I hope you guys have heard of Johnny Immerman out of Chicago. He's phenomenal. He actually teams up former cancer patients with those who are newly diagnosed with the same type of cancer to walk with them on their journey. Okay, peer-to-peer support. There are online communities for Alzheimer's caregivers. I happen to belong to 2 of them, grand total of 6,000 caregivers. Some of these people are new to certain challenges associated with Alzheimer's or other forms of dementia, and they can use these forums to reach out and to others who are more experienced. And get ideas, get guidance, get support from the comfort of their own home. A model that I am really in love with, my friend Denise Brown at caregiving.com, she actually has a caregiver certification program for former family caregivers, again, using resources we have in new and different ways. So I'm going to channel Joanne here for a moment and say that we need a caregiver corps. People who are willing to reach out to family members, neighbors, friends, and colleagues who need support and commit to helping them over the long term. Maybe that's cooking a meal once a week. Maybe it's providing transportation to medical appointments where these types of services are scarce. So new ways of thinking about things, but certainly from the patient family caregiver perspective, these are doable.